Hi, welcome to Pathology Riddles. Today's topic is aortic dissection. What is aortic dissection? When pressurized blood enters in between the layers of aorta through a defect in its intimal layer. This is called aortic dissection. Any blood vessel will have three layers: intima, media, and adventitia. So if through the intima there is a tear, it comes either between media and adventitia or between intima and media. Then this is called aortic dissection. Etiology. It usually happens in men 40 to 60 years of age with hypertension. This constitutes about 90% of the cases. In this, due to hypertension, there will be narrowing of vasa vasorum. Consequently, there will be degenerative changes in the extracellular matrix and variable loss of smooth muscle cells in the aorta. In younger patients less than 40 who have connective tissue abnormalities, for example, Marfan syndrome, it can happen in iatrogenic cases like during cardiopulmonary bypass, in pregnancy due to hormone-induced vascular remodeling, and in cocaine abuse due to abrupt transient rise in blood pressure. Coming to pathogenesis of aortic dissection. So, an unknown trigger will cause an intimal tear, which will cause blood under systemic pressure to dissect through either through between the media and adventitia or between intima and media. This pushes the layers apart and occasionally this ruptures, causing catastrophic consequences. Morphology. Most of the intimal tears are found within 10 cm of aortic valve occupying middle and outer thirds of media. The tears are transverse or oblique, 1 to 5 cm long with sharp jagged edges, extending backward towards the heart or forward towards the iliac and femoral arteries. Microscopy. In microscopy, we will see cystic medial degeneration, which includes smooth muscle dropout, necrosis, elastic tissue fragmentation, and accumulation of amorphous proteoglycan-rich extracellular matrix. We have extensively covered cystic medial degeneration in the topic aneurysm, so link is provided on the top right corner. If you are interested, you can click there and see the video. Coming to clinical manifestation, there are two types of classification. One is Stanford classification and the other one is DeBakey classification. In Stanford classification, it is classified into type A and type B, while in DeBakey classification, there is type 1, type 2, type 3. Coming to DeBakey type 1, it involves the ascending aorta and which extends to the descending aorta. This is DeBakey type 1. When there is only involvement of ascending aorta without involvement of descending aorta, it is called DeBakey type 2. When the lesion starts beyond the subclavian artery, that is, only the descending aorta is involved, then this is DeBakey type 3, also Stanford type B. So there is excruciating pain, tearing or stabbing pain, which begins in the anterior chest. This pain radiates to the back in between the scapula and downwards. This downward pain radiation will be till the area to which the dissection is extending. Coming to complications, the most frequent complication of aortic dissection is death. It will be due to rupture into pleural, pericardial and peritoneal cavity. It can extend into the heart, causing cardiac tamponade, aortic insufficiency and myocardial infarction. There will be compression of spinal arteries causing transverse myelitis, and there might be extension into the arteries of neck, renal, mesenteric or iliac causing obstruction. Treatment. For type A dissection, the most important factor is rapid diagnosis and intensive antihypertensive therapy. And then there is surgical plication of the intimal tear. In type B dissection, it is treated mostly conservatively. So this brings us to the end of aortic dissection. Please do like, share and subscribe if you like the video, and I'll see you next time. Till then, this is Dr. Bismay signing out.